Hi guys, today we are going to be revising human anatomy, and we are going to be reviewing the very first foundations, the basics of anatomy. This is a revision session, and we will be going through some questions that you can expect as you do your exams, your practical exams. That is, this we will deal mostly with gross anatomy, and this is what we do at Discrete Learning Institute. So if you would want to be part of us, you can check the description of this video and feel free to be part of Discrete Learning Institute, where we will do several of such like sessions. Without having been said, we are prepared to begin. For these questions, you will have approximately 90 seconds to 3 minutes, depending on the institution that you're studying from. And so you're required to be quick, but you're also required to be thorough so that you do not make any mistakes. So, question 1, describe what you can see. So you examine the picture, and the question is describe what you can see. Now, you have to be attentive to the words that have been asked of you. So describe is a word that requires you to elaborate, to go into detail. And so your answer cannot be very brief when you have been asked to describe. So describing what you can see, the answer would be an adult male standing erect, face facing forward, hands hanging by the side, palms facing forward, lower limbs parallel to one another, and the feet facing forward. I will repeat. An adult male standing erect, face facing forward, hands hanging by the side, palms facing forward, lower limbs parallel together, and the feet are facing forward. What name is given to this position? This is the anatomical position. What is the importance of this position in medical practice? It is the standard reference point to which the positions of every organ are described. So if you want to describe the position of a particular organ, this is the standard picture that enables us to visualize where a particular organ is located. So that is the importance of this position in medical practice. And all that you have to be able to write within the space of 90 seconds to 3 minutes. In this particular paper where I got these questions from, they had 3 minutes to write or to answer these questions. Question 2, what is shown? So you have to examine the pictures here, and you can see that we are looking at a section of the head in different planes. In plane A, the head has been divided into a front part and a back part. And in plane B, the head and the neck have been divided into a left part and a right part. So what is shown? It's a section of the head in different planes. Name the anatomical planes A and B. So in A, the anatomical plane, the plane that divides the body into a front part and the back part, is referred to as the coronal plane. And B, the plane that divides the body into the left and right, is referred to as the sagittal plane. If it is equal left and right, it may be referred to in some cases as the median plane. So name the anatomical positions A and B. That's a coronal plane, and that is the sagittal plane. Give one important use, pardon the typo, of anatomical planes in medical practice. Give one important use of anatomical planes in medical practice. So the use for anatomical planes in medical practice, let us imagine, for example, our patient here has a tumor. And we want to appreciate how far this tumor, or the extent of the tumor, we want to define where exactly the tumor is. If we were to take image A alone, we're able to appreciate how far the tumor goes below and above, and how far it goes to the left and to the right. But we're not able to determine how far this tumor goes in front or going to the back. We're able to appreciate 2 dimensions. We're not able to appreciate the 3rd dimension. The same goes for B. If we had to examine this tumor and we're able to appreciate how far it goes to the front and to the back, something we can't appreciate from A. And we're also able to appreciate how far it goes above and below, but we are not able to appreciate how far it goes to the left and to the right. However, if we combine A and B, it gives us a 3-dimensional comprehensive picture of what is happening within the body. So one important use of anatomical planes in medical practice is that they enable a 3-dimensional visualization of any lesions, helping the practitioners appreciate the extent of the pathology in question. So when you look at A and B combined, you're able to appreciate in a 3-dimension what is happening than either A and B by themselves. So these are the planes that we have. The coronal plane is this one in green, dividing the body into a front part and a back part. The sagittal plane is that which divides the body into a right part and a left part. And then the transverse plane is the plane that divides the body into an upper part and a lower part. Getting to anatomical planes, transverse plane divides the body into a superior part and an inferior part. Coronal plane into an anterior and a posterior, sagittal into a right and left. These are the planes that exist. What is shown in the image? And the second question is, in what plane has this cavity been cut? So you can see that you're looking at a section of the upper trunk, because there are labels here to enable us to identify. We are told that this is the vertebral column of the body, and we're told that that's the spinal cord. And we're told that that's the aorta, this is the sternum, that's the trachea. So we can see that we're around the chest area. So we're talking about a section of the upper trunk. So the superior part of the trunk, a section of the superior portion of the trunk. And then the next question is, in what plane has this cavity been cut? So the word cavity here should give us a clue as to what they expect the answer to be in A. So if they're calling it a cavity, then it might be a good idea for us to refer to this as a thoracic cavity section. In what plane has it been cut? Is this a front and back, a left and right, or an upper and a bottom? And I hope you can see that's a left and right. So this is a sagittal plane. The next question is, what is the plane perpendicular to this plane called? So all planes, like the XYZ plane in mathematics, intersect each other at 90 degrees. So if we have a sagittal plane and they're asking for a plane that is perpendicular to this plane, we should know from that that the coronal plane and the transverse plane would be perpendicular to the sagittal plane. However, there is another qualifier. It cuts the body into two symmetrical halves. So if it is cutting the body into two symmetrical halves, then we need to find out which of the two planes between coronal and transverse is cutting the body into two symmetrical halves, because both are perpendicular to the sagittal plane. And to be honest, there is no answer, because if we cut into a front part and a back part, they wouldn't be symmetrical. And if we cut it into a superior and inferior part, they wouldn't be symmetrical. So there is no plane perpendicular to the sagittal plane that cuts the body into two symmetrical halves. The answer does not exist, so to speak. But if you not sure what the person who prepared these questions was thinking, but if you had to pick one, you would have to decide between the transverse and the coronal. And the coronal might be a little more symmetrical than the transverse, because the transverse, we have feet at the bottom, or lower limbs at the bottom, and you have a head. But the coronal, you can sort of put them together in a symmetrical kind of way, but they are not symmetrical. There is no plane, technically speaking, that divides the body into two symmetrical halves, because even the sagittal plane does not, strictly speaking, divide the body into two symmetrical halves. You have organs on the right that are not on the left, and vice versa. So if you get one particular half, it's not really an identical half to the other one. Uh, that is not the case. So this is question 3. And so what is shown, a section of the thoracic cavity, of the thorax. In what plane? This is a sagittal plane. What is a plane perpendicular to this plane? Chord, which cuts the body into two symmetrical halves. Maybe coronal might stand a little higher than transverse. Coronal plane might stand a little higher than the transverse plane. Question 4. Describe what is shown in the image. What anatomical movement is shown? In how many planes does this movement occur? So if you look at what is shown in the first image to the left, we can see a female standing erect with the left upper limb making a rotatory motion against the axis, which is the shoulder. The shoulder joint is the axis, and the left upper limb is making this rotatory motion, or this conical movement. Conical, you can see it's making like a cone. So you can say female standing erect with the left upper limb making a conical movement against the shoulder joint. So the axis is the shoulder joint, and the entire left upper limb is making this rotatory motion. And then the second image, you can see that the leg is equally making a rotatory motion, or a conical movement, against the hip joint. So that would be the description of what is shown in the image. What anatomical movement is shown? So you have to revise the different movements that are there. And this particular movement is referred to as circumduction. In how many planes does this movement occur? So if you examine this movement, at some point, At some point, this left upper limb is closer to the body. At some point, it is further to the body. So there is a left and right movement. At some point in this movement, it will be in front. And then at some point, the upper limb will be anterior to the body. And it will also be at some point posterior to the body. So you can see there's that anterior and posterior movement. And then you can see at some point it is at the bottom, at some point it is above. So there's a inferior, superior, anterior, posterior, and there's the left and right movements all accounted for in this particular movement. So all the three planes are accounted for. The same thing with the lower limb. So 3 planes. In how many planes does this occur? 3 planes. You can go on to list the 3 planes. Then we have question 5. What anatomical term is used to describe movement A, B, C, and D? So if you look at movement A, there is movement of the plantar surface of the foot, the sole of the foot. It is moved medially. And this is called inversion. INVERSION, inversion. And then we have B, where the sole of the foot is moving laterally. And this is called eversion, where it is E instead of IN. And then we have C and D. So the normal position is this one in the center. If it moves in C, we call it plantar flexion. The plantar surface of the foot is, we call it dorsiflexion rather. The dorsum of the foot is moving superiorly. It's dorsiflexion. And then the lower part of the foot, the plantar surface of the foot, if it is moving inferiorly, we call it plantar flexion. So that's dorsiflexion C and plantar flexion D. And then examine the picture shown. Who is the person shown in the picture? What is he famous for? When did he live? So this person is called Andrei Vesalius. Andrei Vesalius. And what is he famous for? He is famous for being the founder of modern anatomy. Prior to his time, most people relied on the anatomy of animals and the writings of Galen. But when he came into the picture, he was the first person to begin to cut human cadavers to study anatomy. So he is the founder of anatomy because anatomy is a compound word having 2 words, ana and tome. Ana means upon, and tome means cutting or dissecting. So anatomy means what you would see upon cutting or dissecting. And since he was the first person to ever cut human beings, he is considered to be the father of modern anatomy because he was the first person to cut human cadavers for the sole purpose of studying their structures. And even wrote a book to that effect. When did he live? He lived in 1514 to 1564. He was a contemporary of Martin Luther, for those that are followers of history. 1514 to 1564. And then we have this question. Analyze the biomechanics of a squat. And that is a squat there. And then the question is, which anatomical movements occur in the upper limb and in the lower limb? So you can see that in the upper limb, it is one position, but in the lower limb, there are positions, different positions, depending whether the person is ascending or descending in the squat position. So that being the case, we're going to go to the upper limb. So with the upper limb, you can see that the upper limb or the arm is anteverted. the arm is anteverted. So anteversion is movement of the arm in a forward direction. Retroversion is movement of the arm in the backward direction. So the arm is anteverted. And then you can see that these two bones here are close to each other. The arm is not extended, but rather it is flexed at the elbow joint. So there is anteversion of the arm at the shoulder joint, and there is flexion at the elbow joint. And then there is also flexion of the phalanges, of the fingers. So that's what's happening in the upper limb in both the ascent and the descent. The arm is activated, the elbow joint is flexed, and the fingers are also flexed. Then we come to the lower limb. So in the descending position, you can see that this angle between the angle between the trunk and the thigh is reducing. So there is flexion at the hip joint. And you can also see that the angle between the thigh and the angle between the leg is reducing. So there's also flexion at the knee joint. So there's flexion at the hip joint and flexion at the knee joint in descent. And then when the person stands, there will be extension. So when the person stands, there will be extension at the knee joint and extension at the hip joint to try and get back into the normal anatomical position. So those are the movements that you would be expected to highlight during an assessment. Then we have identifying the different positions, A to F. So A, you can see that it's lying in supine, lying rather in the prone position. So A is lying in the prone position. B, they are lying on their side. This part, they are lying on their right side. So this is called the right lateral recumbent or the right lateral digitus. And then this would be the left lateral recumbent or left lateral digitus. And then this is called the supine position. If they're in supine and they are somewhat erect, then it is called Fowler's position. Fowler's position. And then if they're supine but the entire body is elevated towards the limbs and the head is inferior, then we call it the Trendelenburg. It's called the Trendelenburg position. So these are the different positions that are shown in this image. And then finally, we have a few multiple choice questions. You cannot expect these in an assessment. However, it's important for you to revise to see whether you can actually know these terms. The heart is medial to the lungs, true or false? The answer is true. The lungs are in the sides, the heart is in the center, so to speak. So the heart is medial to the lungs. The thumb is medial to the pinky finger. So with respect to the anatomical position, is the thumb closer to the center or is the pinky finger closer to the center? So this question, the thumb is medial, closer to the midline than the pinky finger. I hope you're saying that is false. It is lateral. The elbow is distal to the wrist, and this is false. The elbow is proximal to the wrist and not distal. The hip is proximal to the knee. That is true. The big toe is lateral to the little toe. That is false. The big toe is medial. It's closer to the midline than the little toe. The skin is superficial to the muscles. That is true. The spine is anterior to the sternum. It is false. The spine is posterior, not anterior to the sternum. The nose is superior to the chin. That is true. The liver is inferior to the diaphragm. That is true. The shoulder is distal to the elbow. that is force. The shoulder is proximal to the elbow. So this marks the end of our session today. I hope you found this helpful. We shall see you in the next session.